Hello, my name is Veronica, and today I would like to talk about a health initiative to expand virtual access to comprehensive perinatal services program for women in the Central Valley of California. CPSP for short is a public program funded by the Title V through the California Department of Health and is available for any patient with Medicare coverage. CPSP provides a set of enhanced perinatal services such as nutrition, social psychological risk assessment, and case management in addition to the traditional obstetric care. The population we serve at Family Health Care Network, according to the 2018 Health Resources and Services Administration, was a total of 184,518 patients. 96% of those patients were reported an income at or below 200% of the federal poverty line. 90% of those patients had Medi-Cal. 75% were Hispanic or Latino ethnicity, and 46% were within the childbearing age of 15 to 44 years old. Women who belong to low-income brackets have increased risk for pregnancy and delivery challenges. Across the tri-counties of California, Kings, Tulare, and Fresno, low-income women are associated with the delivery of low birth weight infants. These infants have a challenging start in life with the increased risk of neonatal death. These challenges have been seen to result in major costs to their parents, taxpayers, and the society. Since the first case of the coronavirus 2019 infection reported in Wuhan City, China on December 9, 2019, the pandemic unfortunately continues to spread. As of the beginning of December 2020, the United States has become the epicenter of the outbreak worldwide with over 13 million infected cases. Across the tri-counties of California, Kings, Tulare, and Fresno, the total cases are proportionately climbing as well. As the pandemic unfolds, medical organizations worldwide scramble to identify the disease characteristic while formulating triage, testing, and providing treatment guidelines for the infected and the vulnerable. Unfortunately, pregnancy is a continuum condition that opens a window of vulnerability for pregnant mothers and fetuses during this pandemic. Due to the pandemic, Family Health Care Network follows the guidance published by the American College of Obstetrics and Gynecology to reduce the risk of exposure to pregnant mothers. Televisits and virtual care are offered to qualified patients. Only necessary outpatient visits are prioritized to prevent unnecessary exposure in clinics or in hospitals. Unfortunately, with that, we have seen a sharp decrease in the number of participants enrolled and fulfilled in all clinic requirements for our CPSP program. At Family Health Care Network, we understand the importance of access and transportation as a vital health determinant to our patients who live in rural towns. So we created a transportation services for patients who desire to be seen but without a form of transportation. However, the services have been postponed due to the increased risk of COVID-19 exposure. Telemedicine, including virtual visit, have been offered to patients who qualify and whose insurance plan cover. Since January of 2020, the enactment of both coverage and payment parity for telehealth services in California has allowed telemedicine coverage to become more comprehensive. As part of this healthcare access expansion, prenatal and postpartum services are offered virtually to prevent unnecessary exposure whenever possible. An example of an interim schedule is reflected here below. However, until now, there is no specific guidance or health initiative proposed for the enhanced services provided by CPSP. This creates hindrance to the access necessary to provide comprehensive perinatal care to our low-income pregnant patients. This health initiative aims to increase access to CPSP for the population of Fresno, Kings, and Tulare County through telemedicine and virtual visits. Patients enrolled in CPSP will be given an option of receiving any of these services below virtually by the usage of phones or tablets. Patients can expect to receive the same quality of visit, such as a virtual orientation, initial and ongoing assessment, healthcare development, care coordination, appropriate nutrition, health education, psychological interventions, and last but not least, referral services from our comprehensive prenatal team. Instead of in-person and in-clinic consultation, the telemedicine initiative of CPSP proposes the use of virtual visit via telephone with an option of video camera, interfacing to deliver the same assessment, educational material, and applicable referrals at the comfort of the patient's own home. Our goal is still to maintain the CPSP model of care across all the visits. Volunteer participation in all medical services, client-centered services based on each client's prioritized needs, individual care plan to each client's strength and unique situation, culturally sensitive care that respect the patient's values, beliefs, and tradition, multidisciplinary team of healthcare practitioners working together to address the client's full need. Last but not least, community-based referral to local services provided by the client's immediate community. This telemedicine initiative of CPSP allow providers and their team to break through the barriers created by the COVID-19 pandemic by providing comprehensive perinatal care while promoting safety and compliance with quarantine policy. It is also a viable option for our pregnant mothers to receive comprehensive perinatal care post-pandemic as well. Nationally, Baldwin and his colleagues did a great job in the study below. The study shows women who enroll in the Medicaid Aid to Family with Dependent Children program and gave birth to live infants. Since the expansion of Medicaid in 1989, federal initiative was started in both states thanks to available reimbursement of enhanced prenatal care services. The study found an increase in the completion of all expected enhanced prenatal services in both states. Over time, an increase in compliance gave the study a closer look at the low birth weight rates affected positively by the expansion of enhanced perinatal services shown in Figure 1 below. The Figure 2 below compares and contrasts the low and the very low birth weight outcomes for the period between 2014-2018 between the state of California, Tulare County, and Family Health Network. The figure allows the correlation to be drawn between the positive effect of CPSP has on birth weight outcome at the state and the organizational level. It also visualizes room for improvement when it comes to Family Health Network and collective county of Tulare. To evaluate the effectiveness of this initiative, we would collect data for the 3 counties over time to reflect any correlation between the usage of virtual comprehensive perinatal services to the percentage of low and very low birth weight outcomes. It is undeniable that CPSP has made a large difference in birth weight outcomes and infant mortality morbidity for patients of a Family Health Network in the county of Fresno, Kings, and Tulare, the state of California, and beyond. The program continues to save more money for taxpayers each year while lessening the burden on an already very expensive healthcare system. However, there is continuous value in evaluating our programs to identify barriers impeding accessibility and inclusivity of the program. In order to ensure the long-lasting effects of CPSP, continuous reassessment, evaluation, and training must be provided to CPSP providers and staff alike. More data and more recent research are needed to assess the effects of CPSP on our populations. With the unfolding of the coronavirus 2019 pandemic, we need to embrace the challenges and continue to find new mediums and solutions so that such meaningful services can be provided to every pregnant woman. A virtual option to our wonderful comprehensive perinatal services can help us bridge that gap and continue to achieve our goals. To decrease the incidence of low birth weight in infants and improve every pregnancy outcome through enhanced perinatal care, giving every baby a healthy start. Thank you for listening.